Good afternoon. How's it going? All right. Welcome. I think we'll go ahead and get started. And welcome to our weekly COVID briefing for healthcare providers. This is the September 30th edition. And we'll go ahead and start with something that we've been working on that is hopefully going to help clarify where everyone is with the boosters. So this is a draft of the health advisory. We're about to launch it. We're happy with the way it reads, but I want to share it with you in case you have any questions or want to help us wordsmith, which is a fancy way of saying trolling, and let us know if there's anything you want us to change. So this is basically, all about the Pfizer boosters. Those are the only boosters that have been approved. The Pfizer vaccine is marketed as Comirnaty, which is a terrible name, but it's a good product. And that is now approved for 16 years of age and older. And the EUA is for 12 and older for those that want to go ahead and get it at that age, as well as for immunocompromised individuals. As you'll recall, on September 17th, they approved a booster dose for seniors and others at high risk of severe outcomes, quote unquote, including healthcare workers who are 6 months or later after the completion of their second dose. And the social risk, social inequities can also represent a risk. So it's intentionally vague, in my opinion, because it allows people to kind of assess themselves as whether they're high risk or not, depending on where they live, where they work, who they live with, what their past medical history is, if it's not clear cut that it's immunocompromised. And that's basically all we're going to say. We're basically also going to point people to the My Turn app, which will now accommodate the third dose as an additional dose. There's a lot of other pharmacies, CVS, Walgreens, Rite Aid, Safeway, Costco, that will also accommodate your patients. So it's basically a short and sweet guide, but it's something on paper. You can now use it to move forward if you needed this to start your booster process. Are there any questions? Oh, let me show you one more thing, which is really cool. My team is really, really awesome for developing this. They're calling it a matrix. And this is basically just a map of, by brand, what people need to know about all the different vaccines. So by brand, there's Pfizer, Moderna, Johnson & Johnson, and then they break it down into what age group needs what. So 16 and older, 12 to 15, 12 to 15 and immunocompromised, and then the one additional dose, which was just approved as a booster. So we're going to have a little blurb right there next to the booster. For immunocompromised individuals, the same thing applies for Moderna. The booster hasn't yet been approved for that. And then the Johnson & Johnson, like I said, they're kind of just left dangling with the one dose with no clear indication on who needs a second dose and when. So we think this is helpful. Hopefully it will help teach you, your staff, and your patients about what the expectations are and what the recommendations are. I like how it's shaping up with the fall colors, and hopefully it'll help you make some good decisions if you're in a place of confusion about all of this. So let me stop there and see if there's any questions. It's about the booster advisory and the matrix.
I have one question, Dr. Vohra. So if I receive the booster prior to the actual FDA approval, it was only like a week before, and I register on the California site, it came back and say, congratulations, receiving your first vaccine, first shot of the vaccine.
Yeah, I don't know. I think that the website is to register people for appointments. I don't think it's a good record keeping website. I think that what you're asking about is how do you keep a good record of that? And
Mm-hmm.
the electronic medical record where you got that vaccine, or the little vaccination cards, which, they leave a lot to faith, but apparently that's what the country thinks is the best way to track vaccinations, is to have people hold on to little paper index cards.
Okay.
But that's basically what people are honoring in good faith. And so wherever you got your third dose, or your booster, you can basically ask them to fill in the third line on that, because that's really what the process is.
Okay. Mine is a little more confusing because I received my initial from all the healthcare worker from
Yeah,
CRMC.
right.
So actually, my portion, the first two shot was in my chart, which then they print out a different
Yes.
thing.
Well,
And then now I have a little card.
I did
So,
the same thing. Yeah. And I went back and asked CRMC, and Gail is on here. She can explain, to give me a card because so many places seemed like they were going to request it.
mhm.
And then they just created a card that documented the stuff that was in my chart.
Oh,
So,
okay.
you can get a card made retroactively, I guess, if you're one of the CRMC folks. At least that's what I was able to do, and I think a lot of other people have gotten that too.
Okay. Okay, that sounds good. Thank you.
Sure. I don't want to put Gail on the spot, but is there plans at CRMC to offer? I'm sure they're doing flu vaccinations. Is there a plan in place to do the boosters as well, for Pfizer?
I can answer. Oh, go ahead.
Oh,
Go ahead.
Go ahead,
Perfect,
Tom. Yeah, go
Dr.
ahead.
Machek, thank you.
We are planning, we have a planning meeting actually right after this call, and we will be hopefully starting appointments planning next week.
Awesome. Okay, thank you. That's much appreciated. I know you've got a lot of other things to worry about, so we definitely appreciate you working on that as well, Tom. All right, let me move on. Like I said, we will send out all of these materials in the packet to come, but we just wanted to share our drafts with everyone. I'm going to share my screen and go to the interwebs just to show you some of the stuff that's happening at the state level. Well, actually, let's start with the numbers. Sorry. So, this basically is the hospitalizations in the county. You see it says 296 with 62 ICU. The curves, I have to say, they're a little bit heartening to see that, there's been a peak and now it's coming down just a little. And now it's at 296. Same thing with the ICU numbers. This doesn't reflect overall patient census in all the hospitals, but it does reflect the COVID census. In terms of the case numbers themselves, just the raw case numbers, those are shown on this graph. This is on our Fresno County data dashboard. And the numbers are slowing down also, which is happening all through the state. So, I think we are in alignment with the rest of the state that the case trends are going down. Here's the R effective in California. You can see that it's going down nicely, including for the San Joaquin Valley region, which is shown right here. R effective is down to 0.7. In terms of the forecasts, let me just quickly dial in our county forecast. This thing makes you do it every single time, so I apologize, but it's kind of a cool tool and it's giving us good news, so that's always welcome. And the Fresno forecast shows that the dash line is always where we are today. Even though there's been a plateau in the past, it is coming down, and because the R effective is so low, they are forecasting that October will get rosier and rosier for both hospitalizations and COVID ICU admissions, which I'm sure is a welcome sigh of relief for everyone. So that's really what the statewide forecasts are showing. Any questions about the numbers and statistics? All right, let me go through some state and national orders and updates. This is from CDPH. It wasn't an AFL, it was actually a mandate that just came out 2 days ago. And this just says, if you work in adult care facilities, then you're going to need to get your vaccine. And this includes adult and senior care facilities, and other settings which weren't covered before by the big health care worker order, where direct care services are provided, are considered high-risk settings. And they basically are now saying that, these folks are also mandated to get their vaccine by November 30th. So look for that if you qualify. And like I said, this may not cover a lot of people because so many were covered in the original order, but it very much aligns with adult care, senior care facilities, hospice workers, and other kind of miscellaneous kind of job positions, in-home support services, et cetera, that were not covered under the original. So we're still working through this. This just dropped 2 days ago. They didn't even have a pre-warning meeting for the health officers. They just kind of posted it. And so there it is. But it reads very similar to the other mandate that had already come out. All right, the CDC is telling pregnant people to get vaccinated for COVID as soon as possible. This is through a health alert network that you can see here. And that's just because August was the deadliest year for pregnant women on record for COVID-19. And the vast majority, 97% of those pregnant women were not vaccinated, okay? 97% of pregnant patients hospitalized were unvaccinated. So it's just right here. But it was still the deadliest. The highest number of COVID-19 related deaths in pregnant people in a single month was reported in August 2021. The actual number isn't that high, but it's such a spike that they felt compelled to tell people, that unvaccinated pregnant women with COVID are at extremely high risk. So hopefully that will give you, the data in hand to deliver the message that I'm sure you're already trying to deliver to your pregnant patients, which is to get your vaccine. But hopefully this will, sometimes people need to see it in writing. Sometimes they need to see that CDC stamp of approval before they believe it. And so this should hopefully help spur that conversation, and please have it. Please send these letters out to your pregnant patients and get them vaccinated. There's tons of data that shows that it is safe in pregnancy. All right, let's talk about flu. So here's our flu clinics. Hopefully you're planning your own if you have the capacity to do it, because that's a huge community service. And this is something that, we're able to, can you guys still see that? Sorry, I just minimized it. We're able to offer through the county in partnership with a lot of our community-based organizations and federally qualified health centers. But we really need more flu clinics than just the dozen or so that are shown here for the flu season. Let me show you, this is actually internal data from public health that Dr. Kokumar pointed me to. And this basically shows you the influenza-like illness at emergency departments year by year. So as all these different colors represent years. As you can see, some years are worse than others, except last year, which is the dark green line. And look at how beautiful that was. It was really low compared to all the other years. That's because people were masking. That's because we were really aggressive about doing our flu vaccination clinics. We need to repeat that victory. We absolutely need to repeat that victory. Week number 40 is the start of October, I believe. And yeah, it's the start of October, then November, then December. And so it just starts really October 1st and goes all the way through the springtime. And so that is upon us. Flu season is upon us. People need to get their flu shots. Just to show you some other information, which I actually questioned, but apparently Fresno County last season had 0 deaths from influenza, pediatric, adult, or elderly. California had only 52, and nationwide, this is astounding, there were less than 1,000 influenza deaths. So I asked Dr. K whether we're undercounting, because as good as the numbers look, that just seems so low. But I think that this is, if not super accurate, at least points us in the right direction, that influenza really did go away for a year because of the actions that were taken. So just FYI, you know, the flu clinics will make a difference. The masking will make a difference, although unfortunately, you know, people have made up their minds about whether they want a mask or not. And I don't think that a bad flu season is really going to prompt the skeptics and the deniers to put on their masks. Maybe it will, but I'm not optimistic. But anyway, I just thought that this was really interesting that, you know, among all of the really gloom and doom statistics, here's a silver lining about what went right last winter. And hopefully we can repeat that. Any questions about that or any observations? All right, I'm going to move on and talk about substance use disorder because there's a couple of updates related to that that may impact your practice. They're certainly impacting our community. This is a public safety alert for the DEA. The DEA generally doesn't do this. You know, they're in the business of going after bad guys and making big headlines because they've made massive drug busts and stuff like that. But I think that they are basically at their wits' end, as everyone else is, about fentanyl and the fact that it is just flooding the streets. And so they basically put out their first public safety alert in 6 years to warn people that lethal counterfeit pills contain both fentanyl and methamphetamines. They're actually launching a big media campaign with lots of, you know, social media and other, you know, they're even getting into QR codes and stuff. So they're really trying to educate people. The media campaign is called One Pill Can Kill. And it just tells people, you know, that even a little bit of fentanyl can really cause a lot of damage. And I think that it's worth repeating that this is the pandemic that's kind of hidden inside the larger COVID pandemic, is people are still, you know, because of the anxiety and the mental health issues that have been triggered by all of these disruptions, people are really trying to cope with some very counterproductive coping mechanisms, including drug use. And this is really driving just an unprecedented rate of overdose and death. It's very unfortunate. Related to that, so that was fentanyl. Related to that, in Riverside County, this is mind-boggling. The DA of Riverside County felt compelled to make this press release this week, which is that in what is believed to be the largest seizure of car fentanyl in Riverside County, 2 people got arrested. Car fentanyl is actually 100 times more potent than fentanyl. And fentanyl is 50 times more potent than heroin and about 100 more times potent than morphine. So basically, car fentanyl is 10,000 times more potent than morphine. And this was enough to kill 50 million people, 21 kilos of car fentanyl, just a massive seizure. And also cocaine, methamphetamine, and I think a bunch of guns as well. So it's like all of these epidemics kind of run alongside each other. And it would boggle my mind if Riverside County was the only county where this was happening. So we're working just with our law enforcement partners, justice partners to say, what do we need to do to figure out whether this is happening in our county? The problem is, you know, car fentanyl is so powerful that 1 dose or even 2 doses of naloxone may not reverse people, which is a real problem because, you know, that means that basically the safety net that we've tried to establish with naloxone may not work, and that people would end up having a fatality or severe brain damage. The other thing that won't reverse with naloxone is something called Xylazine. So this is the 3rd release from this week about an opioid issue. And this is basically a muscle relaxer, usually used in large animals. So it's a large animal sedative and a muscle relaxer called Xylazine. This is something that's now contaminating the street supply of fentanyl and heroin. And Xylazine totally won't respond to naloxone, but it will still cause a very similar syndrome of respiratory depression, slowed heart rate, hypotension. It will look a lot like an opioid overdose, but it won't respond to naloxone. So again, we have some very confounding substances that, you know, will do the same thing in some cases as opioids, but won't respond to naloxone. And now it appears that they're flooding the streets. This was a report from 2019, but one of the police officers that I shared this with rapidly emailed me back and said, we're finding this on the streets of Fresno now. And so it's out there. And so I just wanted to make everyone aware that, you know, this is not going away. In many ways, it's getting worse and more complicated. But this is just situational awareness, for lack of a better term. And it just means it's up to all of us to help get patients into recovery so they're not going to the streets to look for street drugs. As long as we make street drugs easier to access than recovery, then this epidemic will persist. So just, I guess that's a very not so subtle reminder to get your X waiver. I can help you do that. Once you have your X waiver, it's really easy to get people into recovery and get them pointed in the right direction. And really, hopefully they won't seek out street drugs and succumb to overdoses and deaths. Lastly, in other anti-vaccination news, this man in Illinois woke up and he had a bat in his room. It was chewing on his neck. And then they actually found a colony of bats in his in his house somewhere. Anyway, they very, very strongly recommended that he get the vaccines and the post-exposure prophylaxis. And he refused and he died. So I guess it's an anti-vaccine death, but not the kind that you think of with COVID. The last time that this happened was in 1954, which is why it looks like a grandma crocheted this model of the rabies virus, I guess. But, it's just a very interesting story. Another reminder that, public health deals with these kinds of issues on top of COVID. We actually have we actually have rabies rule outs and bite cases all the time. We have several a week actually that don't make the headlines, don't make the news, but our case investigation division, our communicable disease division, and our environmental health divisions continue to do the really hard work behind the scenes of making sure that this doesn't happen in Fresno County. And so, we really appreciate the partnership we have with our community, that whether it's a bat bite, which is really, really dangerous, a cat bite, which has been described to carry rabies, or a dog bite, which is always a possibility, although it's much lower risk. We really appreciate our community partners really listening to the science and doing the best for our patients in helping them get the post-exposure prophylaxis that they need. Sometimes we'll recommend you do that because we've done the investigation at the public health department and we've determined that it's high risk enough to warrant the post-exposure prophylaxis. Anyway, this is a fascinating case. There's always something new in public health to whenever you wake up and read the news, there's always something new about something going on. So I think that was the really interesting case of the week this week. And I think that's all I have. I think we definitely have lots of time for questions and discussion. Thank you. And it looks like Sim has shared a lot of links. Thanks, Sim. Someone's asking, are the boosters open for Moderna now? And the answer is technically no. I think that a way around that is if you are, on a waiting list and there is a Moderna provider who has leftover doses that they can probably provide you with a booster shot in lieu of throwing those doses away. So wherever you got your Moderna the first time around, you can go back and ask them to see if they would be willing to call you with a leftover dose if you're interested. Otherwise, it's probably just 1 or 2 weeks away. So if you want to wait and you feel like you're in a low risk practice setting, then you can go that route as well. But we feel like it's going to happen sometime during October for sure, that we're going to hear about Moderna boosters. They've turned in the data. The data looks very similar to Pfizer. And we feel like, whatever the FDA and the CDC decided about Pfizer, it's going to be hard for them to decide something radically different about Moderna. And yes, I will send all the links for the folks asking for the links in the chat. Someone asked about the home health agencies and whether those are covered. Let me get back to you on that. I'm not sure exactly how they worded it. I think they said home health aides and those who provide direct in-home services. So I don't know if that covers home health agencies, but that's basically who they're talking about. Workers include, but are not limited to, direct support services staff, hospice providers, nurses, nursing assistants, physicians, technicians, therapists, IHSS providers, registered home care aides, certified home health aides, nurses and trainees, contractual staff, and persons not directly involved in providing care, but who could be exposed are all covered under this order, such as clerical, clergy, dietary, environmental services, laundry, security, engineering, and facilities management. Wow, that's a busy guy. Administrative, billing, cosmetology, personal training, and volunteer personnel. Man, I hope that's more than one person that's in charge of all that stuff. All right, let me see if there's any more. Please feel free to speak up also in the chat. Any other questions or comments? I'm just going to add my links to the chat here. All right, well, if there's no other questions or comments, I think we'll give everyone back a good chunk of time. I know you remain very busy, and I thank you for everything that you do. Oh, hey, Chris, do you have something to share? Chris Staub?
I'm trying to unmute. There we go. Hi, Dr. Vohra.
Hi.
Actually, I'll just say the usual. We'd be happy to have some more volunteer blood donations. We're doing okay at the moment, but as usual, we're low on type O blood. So we welcome anyone to come to our centers. Go on the website, donateblood.org. And particularly if you're type O, all types needed, particularly type O. But I wanted to tell a story that in the last few days,